Welcome to the Life COVID-19 and Influenza A and B home test tutorial. This video will guide you step by step on how to properly perform your test and interpret your results. Before we begin, please note, you'll need a timer or watch that is not included in the kit. Before starting, wash your hands with soap and water for at least 20 seconds, or use hand sanitizer. Make sure the surface you'll be using is clean and dry. Do not open any materials until you're ready to begin. Leaving the test cassette exposed for an hour or longer may cause invalid results. Check the expiration date printed on the outer box. For updated expiration information, visit wandfousa.com/welllife/expiration. Locate the red circle on the box. That's your tube holder. Insert the buffer tube into this holder so it stands upright and stable. Remove the large cap from the buffer tube and set it aside for later use. Then, open the sealed pouch containing the test cassette and place the cassette flat on the table. Open the swab package and hold the stick, being careful not to touch the soft tip. Gently insert the swab no more than 3/4 of an inch, about 1.5 centimeters, into your right nostril. Rotate the swab slowly 5 times against the inside wall of the nostril. Repeat the same process in your left nostril using the same swab. Again, 5 slow rotations. If you're collecting a sample from another person, wear a mask. For children, the swab may need to be inserted less than 1/2 to 3/4 of an inch. Support the child's head during the process. Note: failure to swab properly may cause false negative results. Now immerse the swab into the buffer tube and ensure it is touching the bottom of the tube. Swirl it in the liquid at least 10 times to mix the sample thoroughly. Proper mixing is essential for accurate results. Leave the swab in the tube for 1 full minute. Use a timer or watch to ensure accurate timing. After 1 minute, pinch the sides of the tube near the tip to squeeze out any remaining liquid from the swab. Then remove and discard the swab. Securely screw the large cap back onto the buffer tube. Then twist open the small cap at the top. Hold the tube upright, invert it, and add 4 drops of the liquid into the sample well on the test cassette. Dispose of the buffer tube after this step. Remember, the test sample must be applied within 1 hour after mixing. Start your timer and wait exactly 10 minutes before reading the results. Do not read before 10 minutes or after 20. Doing so may lead to inaccurate interpretation. If you do not see a pink or red line next to the C, the control line, your test is invalid, even if other lines appear. Stop and repeat the test with a new kit. If a line appears next to C, but there are no lines next to FA, FB, or CoV, your test is negative. No flu A, flu B, or COVID-19 virus was detected. If a line is visible next to C, and you see 1 or more lines next to FA, FB, or CoV, your test is positive for that virus. Even a faint test line should be considered positive when the control line is visible. Once you've read your results, dispose of the test components safely in household waste. Wash your hands thoroughly. If your test is positive, follow your healthcare providers or local health department's instructions for next steps. Thank you for using the Life COVID-19 and Influenza A and B home test. Early detection helps protect you, your family, and your community. Scan the QR code for more information.